In our series of videos about the pioneers of modern medicine, we have so far covered Ignaz Semmelweis and his work on hand washing, John Snow and his discovery of anesthesia. But in today's episode, we will talk about Joseph Lister and antiseptic surgery. Joseph Lister was born in 1827 in London, England. His father was a well-to-do businessman who wanted his son to follow in his footsteps. However, Joseph was more interested in medicine. So when he finished high school, he went against his father's wishes and enrolled at the University of London to study medicine. He graduated in 1852 and became a surgeon at the Royal Infirmary in London. At the time, surgery was considered one of the most dangerous procedures in medicine. Even small operations could end up being fatal for the patient. This was because of something we now take for granted, but was unknown back then, that germs cause wound infection and sepsis. Surgeons would come into a patient's wound from the outside without even realizing it. They would do this by using unwashed hands or instruments that had been used on other patients. All they knew was that these practices resulted in a lot of pain and suffering for their patients, but they didn't know why. By reading the works of Ignaz Semmelweis, who we talked about in a previous episode, Lister learned about the role of germs in the spread of disease. Semmelweis had done his work on hand washing in Vienna, Austria, and so the English surgeons, including Lister, didn't really think much of it. Lister, however, took his teachings to heart and decided to apply them to surgery. The problem was that surgeons' hands were not just dirty, they were filthy. The smell of a surgeon's hand was actually used to test whether a patient would survive an operation. If the surgeon smelled like perfume, the patient would probably die. This was because surgeons scrubbed their hands with cold water and soap. But this wasn't enough to remove all the germs. In fact, the scrubbing itself would make the hands dirtier by creating tiny cuts and scratches, which would then become portals of entry for bacteria. So it was actually better for a surgeon to have dirty hands rather than scrubbed ones. But Lister had an idea. What if instead of using soap and water, he used a chemical disinfectant? He started experimenting with different chemicals and settled on carbolic acid, which is a form of phenol. He diluted it to 5% and called it carbolic spray. He began using it in 1867 on animals and then humans. To his great surprise, none of the patients died. Over the next 10 years, he continued refining his techniques and developed what we now call antiseptic surgery. This involved spraying the surgical area with carbolic acid, covering the wound with gauze soaked in the solution, and then putting on sterile dressings. He also developed a way to disinfect instruments by immersing them in boiling carbolic acid. This killed all the germs and made the operation safer. Lister also insisted that surgeons and their assistants wear gloves while performing surgery, which was met with some resistance at first because surgeons were afraid that the gloves would get in the way and impair their ability to feel what they were doing. Word got around that Lister was performing miracle operations without any patients dying from infection. Soon doctors and surgeons from around the world came to London to observe his work. By the 1870s, antiseptic surgery became the standard of care in hospitals around the world. An interesting side note is that Lister himself didn't really consider himself a scientist. He said, "Science has nothing to do with the matter. It is a mistake to suppose that it is the business of a surgeon to invent new antiseptics or to spend his time in analyzing their effects." He believed that antiseptic surgery was common sense and didn't need any scientific backing. In fact, he disliked scientists and thought that they were always trying to find something new when what was needed was already known. He said, "All that the profession requires is to know what is best and to do it." That quote kind of reminds me of Steve Jobs. I wonder if he would have liked Steve Jobs. Anyways, Joseph Lister died in 1912 at the age of 84. He never won a Nobel Prize. But there is a hospital named after him in London, and another one in his hometown of Liverpool. There is also a species of bacteria named after him, and it's called Listeria monocytogenes. Fun fact, that bacteria is the only one that can grow at the pH of a human body. So, yeah, kind of a bummer. Anyways, that's all for today. If you enjoyed this video, please hit the like button. Thank you very much for watching, and I'll see you next time.